So, hi everyone. Thank you for joining me today in our talk about the link between gut health and mental health. And I'm really excited to share with you the information about how our gut can contribute to our mental health issues and what we can do to help minimize the effects and regain control of our lives. So, here's a disclaimer that I have to put out there. The information in this webinar is not intended to diagnose, treat, or cure, and it's not to be considered medical advice or a substitute for medical advice. If you do have any questions, please reach out to your provider. So, this is an overview of what we will cover today. We have an introduction, overview of the digestive system, neurotransmitters in our gut, nutrient deficiencies, lab testing, gut health, and then questions. So, introduction. So, about me, my name is Vindira Risalmaraj, and I'm a board certified functional nurse health coach. I have over 15 years of combined healthcare experience and education. So, over the last 5 years, functional nutrition and functional medicine has been my focus, and it has greatly improved my overall health and well being, as well as my family's. I never knew that specific foods, could be the cause of my own physical symptoms as well as my mental health issues. So, this experience led me into becoming a board certified functional nurse health coach so I can support others on their journey to finding out the root causes of their ailments. So, what is functional medicine and functional nutrition? Functional medicine is finding out the how and why illness occurs and getting to the root cause of it. And functional nutrition is finding the right foods that work with your body to help with optimal functioning. So, looking at mental health through a functional medicine lens, what does this mean? We need to dig deep, not just assessing the signs and symptoms, but understanding how that individual got there. So, before we begin, what are some of the mental health diagnoses that can be helped through a functional medicine perspective? Well, these include ADHD, panic attacks, PTSD, OCD, depression, and bipolar disorders 1 and 2. So, what are the possible root causes as we look at the diagnoses? So this is just a snapshot, but there's diet, which includes processed and ultra processed foods, food dyes, and chemicals. The environment, such as the products that we use for cleaning, like house cleaning, for grooming, and then so on. And then nutrient deficiencies, such as low iron, low B vitamins, low vitamin D, and so on. Even having thyroid imbalances, which you can still dig a bit deeper to find out what's causing that imbalance as well. There can be histamine intolerance, trauma, stress, and genetics. And these causes shouldn't really be singled out to say that you only have one root cause, like maybe it's just diet. It could actually be multiple of these. It could be diet, it could be your environment, it could be nutrient deficiencies. And so that's what we have to look at holistically. So let's first begin our talk with the digestive system. It's really important to understand what happens to the foods that we eat. Food doesn't just go from our mouths to our stomach and then out as poop. We actually have to digest the food, absorb the nutrients, and then also convert some of the nutrients into the usable form. So, for example, for lunch, let's say that we're eating baked salmon, rice, and broccoli with tangerines. So, as we take that first bite, that food begins to mix with saliva to help break it down. Now, it's really important that we do salivate prior to taking a bite because while we're eating, that's getting our body ready for digestion. So I always like to say, when you sit down, smell your food, move it around, kind of touch it. When you put a bite in your mouth, what's the texture feel like? Get ready to salivate before you take that first bite. Because saliva, it contains enzymes that are going to help break down the carbohydrates. And when we swallow the food, or it's called a bolus as you swallow it, it travels down the esophagus and into the stomach. So now here, your stomach's already starting to gurgle. It has that stomach acid being released, and it secretes pepsinogen, which helps to break down proteins. So now this mixture in your stomach is now called chyme. So the chyme continues to travel from the stomach, which is right over here, and into the small intestine. So there's the beginning part of the small intestine there. And that's where absorption and transportation of nutrients start to occur. So it goes down to the stomach, and then right into here, the larger part of the smaller intestine. So the small intestine, but the bulk of it. So also going on in the small intestine are the pancreas and the gallbladder, which are accessory organs. They start to release enzymes such as lipase and bile, and that helps to break down fats. So as an example of a nutrient from the salmon that we ate, right? The amino acid tryptophan is from the salmon. And it's because the proteins broke down into amino acids, and that's due to the digestive process. So you can see how food starts to break down, and we have the big parts, such as proteins, and it breaks down to amino acids. And now our body's going to be able to use that form. So tryptophan I bring up because tryptophan is a precursor to serotonin. So, meaning in order for serotonin to be made, we need tryptophan. Serotonin itself is related to our emotions. So, when we have a deficiency of serotonin, it is linked to depression. So, this is one way that we can start to link gut health and mental health. So, we must be able to break down and digest foods in order to absorb nutrients and have them be delivered to the appropriate cells. So, continuing on from the small intestine, whatever nutrients and water is left, the remainder will get absorbed in the large intestine, and at the same time, poop is being formed here. And lastly, you have the rectum, where poop is stored before leaving through the anus. So, it's really important to note that this is a very simple explanation, and the human body is much more complex than what I just explained. We also have the liver, which helps to detoxify foods, medications, and supplements that we take in. And so everything we consume does affect all of our body organs and our systems. So let's talk about neurotransmitters in the gut and the brain. And we're also going to cover the nutritional foods that you can include in your diet. So I do want to add that we can eat all these foods, but we can still have mental health issues. So it's important to not just add all these, brain and gut health foods into our diet, but to also remove the foods that are triggering and contributing to our mental health issues. Otherwise, we're not really going to feel 100% better, or at least, more better than what we were feeling before. So we will briefly cover the triggering foods later. So we're going to talk about the four neurotransmitters today, and they're serotonin, dopamine, GABA, and glutamate. So serotonin is associated with emotions, memory, sleep, and appetite. Dopamine is associated with reward motivating behavior, problem solving, cravings, motor control, and pleasure. And GABA is associated with promoting calmness, and glutamate is associated with learning and memory. So serotonin is associated with emotions, memory, sleep, and appetite. 90% of serotonin is made and stored in the gut, and 10% is actually found in the brain. So again, we can see the link here between gut health and mental health. Serotonin has many roles in the body. It helps to regulate mood, help control bowel movements, controls nausea, helps with blood clotting and bone health. And we also need serotonin to make melatonin, the sleep hormone. So when we experience a deficiency in serotonin, we experience depression, anxiety, obsessive compulsive disorder, phobias, and even suicidal behaviors. So what are some of the foods that we can eat that contain tryptophan to help increase serotonin? So these include salmon, pumpkin seeds, oats, chicken, spinach, and sweet potatoes. So a tip here would be that if you're eating tryptophan-containing foods, be sure to consume a carbohydrate with it, preferably a whole grain carbohydrate, as it increases the absorption. And then vitamin B6 is also needed to convert tryptophan into serotonin. And some of these foods already contain some vitamin B6 in it, like the sweet potatoes and spinach, and even the salmon. I love saying food is medicine because of this. We can eat such great amounts of foods, and they already contain the cofactors and coenzymes, so it all works together. And so a simple meal idea that I think that you could put together if you wanted to would be baked salmon with, brown rice and a spring mix salad with a colorful fruit blend with vegetables, berries, radishes, carrots, and oranges. I love green leafy vegetables, spring lettuce. So those are my favorite things to eat. My rainbow salad, I love to eat with every meal if I could, at least once a day. It's beneficial. The dopamine. Dopamine is associated with feeling good when you achieve something, when you eat, and when you complete self care activities. So it gives you motivation to do something when it's a pleasurable outcome. It's also associated with movement, sleep, behavior, and learning. 50% of dopamine is made in the gut. So dopamine has many roles, which include digestion, lactation, heart and kidney function, sleep, mood, mood regulation, attention and focus, and cognition. So when we experience a deficiency in dopamine, a diagnosis may include ADHD and depression when we are talking about mental health. And when we experience too much dopamine, we see mania, extreme mood changes, energy levels, and or addiction. So what are some of the foods that we can eat that increases dopamine? So like serotonin, in order for dopamine to be made, we need to consume foods that contain the amino acid tyrosine. So some foods that contain tyrosine include beets, kale, chicken, green tea, almonds, and bananas. Next up is GABA. GABA is like the brakes in a car to slow down brain activity and help us relax and maintain a sense of calmness. So GABA calms your nervous system down, and that way you can process information and not feel overwhelmed. Low GABA is associated with ADHD, post traumatic stress disorder, major depressive disorder, and panic disorder. So GABA is found in fermented foods like kimchi and kefir, shrimp, berries, walnuts, broccoli, and whole grains like quinoa, buckwheat, millet, and rice. One of the things I do want to mention is like with if you have a histamine intolerance as well, some things you'd want to be mindful of is eating like kimchi and kefir, things that are aged or have high histamine, because then you could be actually increasing mental health changes as well through that. So glutamate, next up. Glutamate is the precursor to GABA and is abundant in the brain. Glutamate is associated with springing into action, while GABA is going to stop you. Glutamate is associated with memory and learning, the sleep cycle, and pain. And so low glutamate levels is associated with schizophrenia, major depressive disorder. And then excess glutamate is associated with migraines, with tics, and anxiety. So glutamate is something you have to balance, as low or high levels can cause these symptoms. You find glutamate in MSG, Parmesan cheese, processed meats, tomatoes, mushrooms, and anchovies. So MSG can definitely cause its own issues, and I don't recommend it as well as highly ultra processed meats. But I want to point out the foods that they are found in. So that way, if you were consuming these as a major part of your diet, you would kind of look and say, oh, you know what? I'm eating this and I have these symptoms. And that's the part of the functional nutrition is understanding how it's affecting your body. And one of the things that I think I might cover later is that when you eat something, it doesn't just happen right away. It can be days later. So it's always good to food journal and write things out and kind of see how food is affecting you. So that was it for neurotransmitters. So neurotransmitters play a huge role in our mental health, and so can different foods. They can contribute to their making. So, but the foods can also alter the body's internal processing system, and so we can have imbalances. So I want to talk a little bit about nutrient deficiencies. So from a functional nutrition standpoint, we can get the vitamins and minerals and cofactors, coenzymes, and precursors for the neurotransmitters simply by eating the whole fresh foods. And that's what's important for physical and mental health. So let's talk about a few of the key nutrients for mental health. So the first I'd like to talk about is vitamin B6. Vitamin B6 is essential for assisting in the production of serotonin, dopamine, and GABA. The other name is pyridoxine. And vitamin B6 helps to support the immune function, the brain function, and a B6 deficiency has been linked to depression. So, looking at these signs and symptoms of B6 deficiency, some of the symptoms overlap with feelings of depression, such as loss of appetite, drowsiness, and apathy, which is a lack of interest. Other symptoms can include of deficiency can include nausea, hair loss, mouth sores, and dry skin around the eyes. Food sources of vitamin B6. It's going to include organ meats like liver, tuna, salmon, chickpeas, poultry, green leafy vegetables like kale, spinach, and bok choy, and lettuce, and then fruits like papaya, cantaloupe, honeydew, and raisins. Vitamin B12. So this vitamin is needed for red blood cells, the brain and nerve function. The other name is cobalamin. Vitamin B12 binds with intrinsic factor in the stomach and then is absorbed in the small intestine. So when we have stomach issues, including low stomach acid, we aren't able to break down food properly and therefore the nutrients. So we can become deficient. And B12 deficiency can cause psychiatric conditions such as depression, panic, anxiety, and hallucinations. Other symptoms can include numbness and tingling in the hands, imbalance, fatigued muscles, headaches, dizziness, and a fast heartbeat. Food sources for vitamin B12 include organ meats, eggs, green leafy vegetables, such as kale and spinach, nutritional yeast, poultry, and fish like tuna. I want to mention if you take a vitamin B supplement, vitamin B12, I want to ensure that it's working. Get your labs done and see where you're at. There are different types of B12. Some are better absorbed than others. Two of those types would be methylcobalamin, which is a methylated form, and then also hydroxycobalamin. Vitamin D is essential for bone health, immune function, and reducing inflammation. And vitamin D is actually also a hormone. Low levels of vitamin D has been linked to depressive mood and schizophrenia. And other symptoms can include sleep disturbances, back pain, lack of appetite, weak and aching bones, frequent colds, infections, and fatigue. So you can see that some of these vitamin deficiencies, they have similar symptoms to depression where you're not wanting to eat or, having, some bad sleep or like a lot of sleep or less sleep. So just different things like that, something to kind of be mindful of as well. So sources of vitamin D include number one is sunlight. So going outside for about 10 to 30 minutes between the hours of 10 and 2 p.m. can help you increase vitamin D. So the darker skin that you have, the longer you should bask in that sunshine. And the lighter skin you are, you can take in lesser time. And this is without sunscreen. You want to expose your arms and legs. You don't want to overdo it as you still have to consider, skin cancer and other conditions related to the UV rays. But going out each day is helpful to get that vitamin D naturally. And also just going for a daily morning walk. It doesn't only just boost the vitamin D, but it can lower your stress levels as well, being out in nature. And this can help you to also regulate cortisol and melatonin levels. And that way you can have a good night's sleep. The food sources of vitamin D can include fatty fishes like salmon, tuna, and mackerel. And I highly recommend that you consume wild caught fish, whether it's fresh or frozen, or even canned, compared to eating farmed fish. Eggs and beef liver also provide vitamin D. So, iron. Iron is needed by the body to make hemoglobin. And hemoglobin is used to transport oxygen around the body to the different cells and the tissues. So, ferritin is your stored iron in your liver. And a low ferritin can indicate iron deficiency anemia. There are studies that show that iron deficiency increases the risk for mood disorders, depression, and ADHD. So you can see some of the symptoms of iron deficiency anemia. They include shortness of breath, weakness, headaches, fatigue, heart palpitations, restless leg syndrome, and even poor focus. So, what are some of the sources that contain iron? Red meat, chicken, and seafood like mussels, oysters, and clams. Legumes such as kidney beans and chickpeas, spinach and broccoli. And you want to eat, broccoli kind of foods like spinach and broccoli with vitamin C. So I always recommend eating those with like tangerines or strawberries or the rainbow salad because you want to help with the non-heme iron sources like broccoli. You want to help it absorb better in your body with the vitamin C. And you know, poultry itself has its own thing, so it's good to take that on its own. But you could always take a vitamin C with iron just to make sure it gets absorbed into your body. Some other sources that you can do to get more iron in your body is you can use an iron fish. You can just Google that, research it. You put it inside of a pot of water. You can put like a little squeeze of lemon, and it can you can drink it. You can put it in broth or whatever, and it can increase your iron. It does take months to do that. And also, you can cook with a cast iron skillet. But just make sure that you have your iron levels checked because if somebody is good with their iron in your family, you don't want it to be too high because that can cause its own issues. So that ends the vitamins and minerals content. And going through the information, I hope you can start to see the overlap of the symptoms between some of the mental health conditions and nutrient deficiencies. So, for sure, there are other factors that play a role in mental health conditions, but this is something we need to look more into the foods that we eat and how it affects us. We do not want to consume the foods that deplete nutrients that are already in our body or that are not full of nutrients, such as ultra high processed foods and sugar. And we don't want to consume foods that can cause neuroinflammation and gut inflammation, or at least put them in moderation, like you find your threshold, which we'll talk about later as well. But so if we're eating these foods and we're still feeling unwell, I'd like for you to back it up. We need to look at the absorption and the digestion process, and we need to get to the root cause. So let's take a look into gut health with a focus on food sensitivities. So we talked about the foods that we can include in our daily diet to help promote positive mental health. But what about the foods that can deplete these nutrients or foods that just don't work for our body and instead work against our body? So, for example, certain foods, medications, lifestyle factors can inhibit absorption of nutrients. We can also have hidden food sensitivities, intolerances, and even allergies that make us feel unwell for several reasons. So, just because we don't have an anaphylactic reaction or difficulty breathing, swelling of the tongue and lips, that doesn't mean that we don't have reactions to foods internally, because they could always show up, in other ways, whether it's mental or externally, like in hives or eczema. So, I want to share this excerpt from an article that suggests gluten can be linked to certain mental health diseases. So, not necessarily do you have to have celiac disease to have issues with gluten, but there is a term called non celiac gluten sensitivity, or NCGS. So, in this article, it says since 1956, it was suggested that gluten was associated with mood and psychiatric symptoms. And recent clinical studies have found gluten related antibodies in patients with bipolar, major depressive disorder, and schizophrenia. So we don't have to have those specific diagnoses. What I want you to take away is that there are certain foods that can be affecting our mental health, and we are all so different. We're so by individual, and so foods will affect us differently. And I'll tell you that there are so many studies that go back and forth between food and mood, and it could always contradict one another. And so, really, I want you to be able to know that for yourself, you have to do research for yourself with your body and see how things affect you. There's no study that can say that this will affect you or that it won't, because only you will know that because you'll know how you feel. So I say to all my friends, my clients, my family, and my kids that I'm a grown adult and I can go out and I can eat whatever I want, do whatever I want. And I still choose to abstain from particular foods because it does affect my mental health. And for me, that was the biggest part of why I continue the dietary changes that I do, because my mental health matters a whole lot to me. Because it's a lot when you want to wake up each day and you want to be productive and you just want to be happy and just do things, right? So that's why I do the things that I do, and I try to make sure my children understand that too because they see me, and, they're going through the same dietary changes for their health as well. Although we do have our differences, I do cater to their needs separately than mine, but I just want them to be mindful as they get older because they are young, and I want them to just carry this knowledge with them. But so when you have that knowledge, you have that power, and then you feel empowered to make the decisions every day, and that's gonna make you feel your best. So this is why I continue to to live the way I do. And so this is specific to me. I have my own baseline. And so I know that if I added in new foods, then I know how it's going to affect me. Like, so for the other day, we actually introduced popcorn. And so we haven't consumed, popcorn in years, right? Any corn products actually for years. And we did it, and we did really well with it. Now, if I consumed a product that contains citric acid, which is, it could be corn mold derived, I don't do well at all with that. Like, it does make me feel a little bit foggy in the brain. I do break out and, my face breaks out. So it's just not a safe food for me. And so it's just because I've reached the baseline of feeling really good. I can tell when I eat something new how it affects me, mentally and physically. So that's what functional nutrition is about, learning how foods affect you and then learning about your threshold once you reach that baseline. So let's talk about the differences between allergies, intolerances, and sensitivities. So an allergy is usually an immediate response, and it can be life-threatening. You can have swelling of the tongue and difficulty breathing. Examples include like having a peanut allergy. And so the next four are food intolerances. This can be immediate or delayed. Examples include lactose intolerance. And then food sensitivities. It can be immediate or delayed reaction, and that can last for days. And examples include soy and food additives. I definitely relate to food sensitivities a lot because I've learned from myself and from what I've seen from a few other of my clients that they've at least 5 days because sometimes you eat something, it can cause constipation. And then now you have all those toxins building up for another day until you can start removing them efficiently. So sometimes it could take a long time, and then sometimes we forget what we ate and we're like, oh no, it wasn't that. But we have to really track all these things that are going on in our daily life because it is easy to forget things. So food sensitivities are different from an allergy and an intolerance in that it's when you eat something and then a few minutes to hours later and even days later, you're still feeling the effects from the food. And the effects aren't just physical, like bloating and gas. It can be mental, like suicidal ideations. It could be anger outbursts. It could be depression, and it could be anxiety. So it could present in many ways. So how do we identify our food sensitivities? So, in a nutshell, we can do an elimination diet for at least 21 days to reach a baseline of no symptoms. And then we reintroduce the foods we took out one at a time. I prefer that you do one new food a week. And then journal how you're feeling, how you're sleeping, how you're pooping, and things like that. And after you've identified the foods and how they react in your body, physically and mentally, you now enter the maintenance phase, where pretty much you eat the foods that work for your body and not against it. And as long as you continue with a baseline, you can start to find new threshold for new foods because then you're going to start monitoring how you feel when you eat something that's new. So it is a slow process. It does take months to really fully complete an elimination and reintroduction phase. But the information that you learn from that, you can take for the rest of your life. And that's what I want you to take away. That's you're learning how things, how foods affect you. And then not just tracking your food. I can show you in the next page here. Not just tracking your food, but tracking also your emotions, the poop, the urine, your physical activity, your mindfulness, even your sleep quality and your water intake. So this is an excerpt from my journal that I sell on Amazon, and I just wanted you to see the different things that you would fill out. And it's really good information to have because then you get to have insight in how things are affecting your everyday. It is a lot to food journal, definitely time consuming, but the information you get really is insightful. So, lab testing. Lab testing is great for a baseline. We also have to remember that these tests are a snapshot in time of what's going on, and functional ranges are actually different than the conventional testing ranges. So, first, we should ask our medical provider for blood testing to be completed so that we can rule out any deficiencies or underlying diseases. So, for example, if you're tired, you can't focus, you feel weak, and you're feeling a low mood, talk to your doctor about running a full iron panel. And this includes iron, ferritin, total iron binding capacity, and percent saturation. And if you are experiencing anemia, we cannot just fix the anemia. You have to find out also why, like what made it start. For example, if you had heavy menstrual cycles, do you have parasites? Are you recovering from a cold? Is it your diet? So it's really important to start digging deep into why you have these, deficiencies. Otherwise, then it just becomes a band-aid fix, and then the problem will keep reoccurring. The next test is a full thyroid panel because your thyroid, although it can be in a normal range, we need to make sure that it's an optimal range. Not to mention that we need more than a TSH level because sometimes providers will order just a TSH or maybe even a T4, but you really want to get the full picture of how your thyroid is actually working, especially if you've never even had like your antibodies tested. Just advocate for yourself as much as you can and get a full panel done just so you know your baseline for labs. So hopefully you don't think like you have so many things to worry about now. I'm just sharing these symptoms and the diseases with you, but I don't want you to self-diagnose yourself or self-treat because that can be dangerous. But I want you to be aware and just have conversations with your healthcare provider about your health. So you can see in this picture someone who has an altered thyroid function, the signs and symptoms that they'll experience, and it includes depression, mood instability, anxiety, low libido, fatigue, and so on. So, this is why it's really important to rule out any medical conditions that can be mistaken for a psychiatric condition, and that hopefully could just be treated with diet and lifestyle changes. So, for vitamin B12 testing, you'd want to ask your doctor to order a vitamin B12 level, along with a folate level, and homocysteine as well. You can even ask for MMA, methylmalonic acid, which can be done via urine or blood. And these tests help to see if there is a true vitamin B12 deficiency. And of course, then we can begin getting to the root causes of this deficiency. So let's say that some of your lab values do come back abnormal. The thing with functional medicine is to find out why did it go low in the first place. We need to get to the root cause. Because like I said before, if you just treated the abnormal levels, it may or may not go back to normal, or it may go back to normal for a little while and then decline again. So you'd want to find out what's really causing it. So that's all that I have for you today. I hope you found the information helpful. I can answer any questions that you may have now, if anyone has any questions. If there's no questions, then you guys are free to go. Oh, there's a chat. So hold on. Thank you, Candy. Can you repeat the name of the test? Sure, I can go back. Do you know which specific test that you were talking about, Joshua? There was the iron panel. You take a snapshot too of it if you'd like. And then I'm also gonna send the recording out too for everyone who signed up. You're welcome, Joshua.
Vindira, I have a question.
Yeah.
In regards to getting these testings done, how
Mhm.
difficult do you think or have you found it to be to get the doctors to agree to this further testing?
If you have a really good relationship with your doctor, I think they'll be able to order it as long as you come in informed. Because sometimes they will question you, like, "Oh, why do you want an anemia test for? Why do you want all 4 of those labs?" And, you can tell them, "Well, I'm feeling fatigue. I'm feeling like I have hair loss. I'm feeling like I have low mood." And you can tell them these things. And, I think also it's for insurance purposes. They need to find out the codes so they can write it down properly so they can get tested. Because they could get backfired for ordering whatever testing without having a proper cause for it. If you have a doctor who's just saying no, so I've had a doctor who told me, why do you want to get your cortisol tested? And I told her because, I'm having panic attacks. I want to know what my stress levels are at. And, she still didn't order it for me, but she did order some of the other tests, which I did appreciate. But it definitely took some strong advocation. Like, I want my B12 tested, I want my folate tested. And, even when I got back the results from my test, this was years ago, she even said to me everything was normal. But then when I was reading my actual lab report, it even said, like, if you had a B12 level under 400, which mine was, it was under 300, it says you can have psychiatric conditions. And while, having panic disorders, anxiety is a psychiatric condition. So I told her this, and she's like, oh, well, then you could supplement with a B12. Well, that's the thing. You have to advocate. But if you don't know it, it's so hard to advocate for yourself. Um, I know that there are doctors that say, "Oh, stay off of Google." But you know what? If you need to advocate for yourself, go onto Google and just go to the websites like WebMD, there's Medline. There are .gov websites that you can look at to get yourself more informed. So, if you don't have a good doctor, then find a new one. That's all I can recommend for that one because you have to be able to talk to your doctor and not be afraid of asking for tests that you want. But like I said, like, you have to just say, "If I want my thyroid tested, they will just order your TSH or a T4 maybe, but you can tell them, "Listen, these are the signs and symptoms I looked up online. These are the tests that's recommended, and I want the baseline for myself." And, if you're really strong in what you know, I find the doctors are less to give you pushback if you sound informed. And it's okay to sound knowledgeable, okay? It is okay.
I did have another question as well, Vindira, in regards to, well, first, thank you for putting some of the foods that are associated with increasing the B12 and the vitamin D and the iron and things like that. Would you suggest, in the event that, we get these testings and we see our levels, would you encourage eating the whole food or the foods that are um, helpful in obtaining those nutrients naturally? Or at what point would you suggest like a supplement, if at all?
Yeah. So I'm definitely all about food as medicine, but if you are severely deficient, you should be supplementing at, with the safety of the doctor, the approval of the doctor, because you want to bring your levels to sufficient levels and then maintain it with the food levels. So for my B12 levels, it definitely was lower. And I did supplement because I needed to. And I found the methylated ones because I realized that I do have a genetic mutation. So I needed to take methylated form of vitamins versus the ones that are just given like from Nature Made or so forth. Not to call out names here, but like that's what it was. I had to find a methylated version that actually brought it back up to sufficiency. And then that's when I stopped having panic attacks and I stopped having tingles in my fingers when I started doing that. So the root cause for that was stress. So I had to manage my stress levels. So that's where you have to start finding out the root cause of things. It wasn't just necessarily food related that I wasn't eating the food. I'm so highly strung, like I was just under a lot of stress. A lot of different things were happening. I was in nursing school and all these different things that depleted my cortisol, that depleted my B12, that made it deficient. Um, so if you are deficient in something, ask your provider, can you supplement? Find the right supplement for you and then still do the food changes because food is really important. We eat every single day, and start making the changes as soon as you can because it's not gonna hurt you if you ate well, that's the thing. It's not functional nutrition, so it could hurt you, but you wanna find out how you feel when you eat certain foods too, and that's why it's important to track what you're eating because it could be linking to the deficiency too. I know it's a long-winded answer, but it's
No, but I appreciate that because it does help me to, just think through these things. And I mean, not to, you know, do a sales pitch, but I would recommend your book because I do have your book and it has been helpful in helping me to see, like, oh, why am I so tired at, you know, 1 o'clock in the afternoon? Oh, because I ate, you know, 2 slices of toast with jam on it or whatever the case may be, and so it has been very helpful and also with tracking my urine and what that looks like and my poop and, "Oh, why is it runny?" Or, just documenting those things to think through, just to get, like, a fuller picture and not just, "Oh, I must have just ate something." Well, what did you eat? Oh, let me go back and look. And so your book has definitely been helpful and helping me to see also weight gain and when I'm losing a couple pounds and okay, is it near my cycle or whatever the case is? And so I would highly recommend your book, and it has been very helpful and beneficial to me in this journey um, of, trying to um, get a better, healthier lifestyle. So thank you.
welcome. Thank you for, the shout out for the book. I'm glad that you like it. I don't think you guys can see me. I don't know how to really do this thing. Um, Anybody else have any questions? I do appreciate you guys coming out and listening this morning. Bye. Okay, then enjoy the rest of your day. Thank you all for stopping by. Bye. You're welcome.